Helmendollar.
Morning, sir.
How are you feeling today?
All right, sir.
Doing okay? Were you able to get a little sleep last night?
Yes, sir. Hey, Doc, I'm feeling pretty good. Am I good to get back out and train?
As for return to duty, it will be directed by service-specific guidance. In addition, some local treatment facilities and military schools or training programs may issue their own requirements. But three core elements are common to all return to duty decisions: an established diagnosis, a return to normal state from an end organ injury, a period of recovery that allows for exercise and heat acclimatization. For the purpose of follow-up and medical evaluation board determination, the service member will be reassessed weekly for presence or absence of both complications and contributing risk factors. Return to duty is generally driven by the service member's recovery during the 2-week period following the event. The service member's status will be classified into one of three categories. First, heat stroke without sequelae or other complicating conditions. This is defined as having all clinical signs and symptoms resolved by 2 weeks following the event. The second category is heat stroke with sequelae, which is defined as having related medical concerns that do not completely resolve by 2 weeks following the event. This may include any evidence of cognitive or behavioral dysfunction, renal impairment, hepatic dysfunction, or rhabdomyolysis. The last category is complex heat stroke, defined as recurrent or occurring in the presence of a non-modifiable risk factor, either known or suspected. Service members demonstrating certain criteria, despite 2 weeks of rest, should be referred to an appropriate specialist. Heat tolerance testing, or HTT, is utilized by special operations personnel for certain candidates who sustain a severe heat injury. The Consortium for Health and Military Performance, or CHAMP, at the Uniformed Services University of the Health Sciences currently conducts HTT as a research tool. The HTT is recognized by the American College of Sports Medicine for some heat illness cases where return to play is difficult. At CHAMP, the HTT involves a 2-hour test in a heat chamber with continuous monitoring of the service member's heart rate, skin temperature, and rectal temperature both before, during, and after the test. Heat tolerance is demonstrated by a rise in temperature to no more than 38.5 degrees Celsius or 101.3 degrees Fahrenheit, with a plateau in body temperature dynamics. The heart rate must also stay below 150 beats per minute during the test. Heat intolerance is demonstrated by a heart rate that exceeds 150 beats per minute or a maximum temperature of over 38.5 degrees Celsius. When the temperature rises to this level, it typically means that the service member also has not demonstrated the plateau in body temperature dynamics during the test. Heat tolerance testing is used as one piece of information to guide the medical provider in a return to duty decision.